taking the time to attend our presentation, How to Interpret and Plan for the 2014 CMS CEHRT Rule. Our speakers today are Kay Jackson and Cindy Paul. Kay is the Manager of Software Certification and Compliance at Iatric Systems. She has been studying Meaningful Use for 4 years and leads the Meaningful Use Manager product team, which is the Iatric Systems Meaningful Use Dashboard tool. Cindy, a registered nurse with over 20 years experience in clinical nursing and public health education, is a consultant in our Professional Services Division at Iatric Systems. She is experienced in hospital compliance and quality improvement, meaningful use attestation, and audit readiness for hospitals. Cindy's primary role at Iatric Systems is meaningful use project management and consulting and clinical informatics. Now I will turn over to Kay to get us started.
Thank you, Amanda, and hi, everybody. Thank you for your time today. And this is a quick agenda of what we're going to talk about. We're going to start talking about the flexibility plan. I have 2 guest speakers today, and then we're going to have some questions and answers. I want to let everyone know that the content of this presentation was derived from 2 CMS webcasts, and one was a vendor-only webcast. That vendor-only webcast, I grabbed some of the screenshots from. They have not been published yet. They have to go through the remediation process with CMS, the 508 compliance, and it usually takes about 2 weeks. But once I get those final slides, I will put them on our Meaningful Use Forum, so if you're interested in seeing it, or if you're signed up for that, you'll see it. If you're not, let me know, and we can sign you up for that. This rule, I really think that every hospital should read the full 196 pages. They give you some examples. I'll talk about a few today. But you really need to review the issues and make your decision. Vendors can't tell you what to do. Don't listen to others outside your hospital. Your hospital needs to make the decision based on the rules. If you are going to use the vendor was not ready as part of your plan, then I really suggest you get a letter from the vendor stating that. I did mention we have 2 guest speakers today. One is Mickey Waters from Conway Regional, and then Lyndel Mead from Peterson. They're going to tell you why they made their decisions. And if you have questions for either of those speakers, please put them in the chat window, address them to the person you want to ask the question to, and then once we open it up for Q&A, we'll be able to address those to the 2 speakers, and then we'll have some additional Q&A later. If we aren't able to answer the questions, we'll get the answer for you and give it to you later. I did want to say, CMS really disagreed with what a lot of people said. I don't know if you went and made any comments when the comment period was open, but a lot of the comments they were seeing was saying, hey, you're really helping hospitals that waited to the last minute. You're giving them a free pass, and you're punishing the early adopters. And CMS has been very strong in their suggestion that is not what their intent was with this regulation. So let's get started. Again, I've got this for you, the source of where I got the information. There's also a CMS webcast that follows today. So if you want to do a web search and get that information, CMS is having a repeat webcast of what they did last week about this very rule. So first of all, I just put the quick definition of what the flexibility rule is. So many people were complaining that they weren't ready to attest. Vendors were having a hard time, and I can tell you as a vendor, it was a very short period of time. You got the information, you had to set your system up, then you had to go get certified with a testing body, then you had to implement. Very narrow window of time. And the Stage 2 rules were very different than Stage 1. So this was, at the last minute, CMS listening to the comments and coming back with, okay, this is how we're going to handle this rule. So this is the slide shot from the presentation. I just grabbed it for you. The thing that I think you need to really pay attention to is not fully implement, and we'll talk a little bit about what CMS means by that. I have another really great slide that they did that we'll show in just a second that will really help you narrow down where you might fall. But this is what we've heard. I got this from the Meaningful Use Audits Company. If you're not a member of that, providers can join for free the Meaningful Use Forum. They've got some really good education sessions. But their definition of availability is to include if the provider is not able to fully implement the 2014 version. And this is what they describe as not fully implemented: staff training, system testing, workflow, updates and integration, software patches, or workflow changes. you notice a lot of it goes back to that 2014 version of your system. So there's two different groups, I think, that are interpreting this regulation. That's why I'm saying you have to look at it, read it, and decide how you're going to interpret it. It really made it more liberal, and they did define it. But I will tell you, I'm going to read part of this because it's very important that you know, hear this, and we will send it to you. But the agency did not provide an exhaustive list of every possible scenario in the proposed rule. In other words, they didn't say, here are the 5,000 reasons why you can take advantage of this rule. What they did is they just put the reasons why you could not take advantage of the rule. And one of the things they stressed in both webcasts I attended is it can't be something like, oh, Susie's the CIO and she went out on maternity leave and we just weren't able to do it without her being here. Those are not some of the things that they are saying or reasons that you can take advantage. Or they also mentioned, say you're doing really good except for 2 of your measures, and you're failing those measures. You can't take advantage of that because you're not meeting the measures. So again, that 196 pages, there's a lot of good information. This is the final rule, a provider's ability to fully implement all the functionalities of 2014 CEHRT may be limited by the availability and timing of product installation, deployment of new processes and workflows, and employee training. So I talked to one customer that their ED system only got certified in August of 2014. They don't even have it installed yet. They are going to take advantage of the flexibility rule because they don't have that 2014 version. So they're going to go into the chapel, select their 2011 certified ED system, and they'll be using everything else for 2014, but that cripples them. They're doing the all ED method. They don't have a lot of the new information that they needed because the vendor did not get them their software in time. So the final rule also extended stage 1. Stage 2. We've all heard about it. They announced it last December, but this puts it into the final rule. So again, we had stage 1 for many, many years. Stage 2 is going to do that same thing. So early adopters that are going to attest, we have a site that attested in July for stage 2. They will do stage 2 3 full years and then be ready for stage 3. So, oh, sorry, I went too fast. This is just the revised timeline that CMS has published showing that it's going to start in 2017. Now, remember, for hospitals, 2017 starts October the 1st of 2016, so we're about 2 years away. CMS says they're going to publish the final rules next August. So think about it. If they publish them next August of 2016, they have the test scripts available for vendors in January of 2016, which is about 5 months later. Vendors will have a very narrow window of time, again, to do their updates and get certified. So I think we're going to be in the same process or same predicament in 2017 because it's such a short window of time. So they did publish it. It came out on August the 29th. They had told me it was going to come out on September the 1st, so they surprised me by a couple of days early. But still, August the 29th is kind of late in the time for you to hear that there's going to be options. So they did give options. They did extend the period for 2016. And again, these slides came straight from CMS. In fact, Elizabeth Myers, who is my #1 go-to person at CMS, did this presentation. The flexibility is only available to providers who are unable to fully implement. I read to you some of the definitions of what fully implement is. We're going to send you the final rule. I'm going to tell you the places where I read what fully implement means for you to then digest that information and make sure that you're following what the intent of the law is. They also said that the first-year Medicaid participants must use the 2014 CEHRT. So if you're first-year Medicaid, just keep that in mind. I don't think there's many left of that, but there may be some. So the main question I had after this came out is attestation system. I don't know if any of you are in the state that have tried to attest this year to stage 1, and the system says you're in stage 2. They made some mistakes. What happened was a Medicaid provider for that state reported into CMS the wrong year. So states, I know Connecticut was involved in that. I've heard a couple of other states. They went to a test for stage 1, year 2. CMS attestation shows them as stage 2, year 1, so they couldn't attest. And CMS says they'll have that fixed by October. They also say with this flexible rule that the system will be available mid-October. I will believe it when I see it. But they also reminded everybody that you need to go to the chapel and get the CEHRT number. You know, that's where you go and put everything in your cart to get that Medicare ID number that you have to have. You should do that every single year. And be sure to indicate if you're going to be using, like my example, my customer that's going to use the 2011 version of their ED system when they go to the chapel, they need to put the 2011 version of their ED system, 2014 for everything else. If you've looked, they have never published the 2014 attestation user guide. They said that they were holding up on it, but it's going to be available soon. So I don't know when soon is, but as soon as I get a copy of it, and they usually send it to the vendors first, I don't know why, but I will put it out there on the I-form, and you'll be able to get it there. But there are some big differences when you attest this year, especially on the CQMs. They are now by domain. So this is the slide they showed to show you if you're in stage 1, these are your 3 options. So again, that example from my site that has the 2011 ED system and 2014 everything else, this is where they're going to fall into. I also have the slide for stage 2. So again, this is coming from CMS. The thing that I liked about this slide is that it does tell you about your CQM. So, for example, if you go back to the 2013 rules, which means you have no portal, you'll have to do core 11 and 12 that were retired, and you'll have to do the 2013 CQMs. So it has to match. They made very, very strong statements on the webcast is you can't mix and match. It's the 2013 rules or it's the 2014 rules for all measures. This is another little graph that they provided, kind of walk you through what your options are. And then addressing public comment, the attestation, I had thought since I had heard that it takes them 3 months to change their system. That example I just gave you about the wrong dates, customers found it in July. CMS said, well, it takes us 3 months to change our attestation portal, so they can't attest till October. So those sites have been sitting on hold waiting for the change to be made in October. So I asked CMS, if it takes you 3 months to change your attestation portal, will it be ready in October? And they've assured, and they've said, again, I don't know if they'll really make it or not, that they will be ready. You'll be able to report or attest to January, February, and March, or if you want to do October, November, December of last year, or April, May, and June, or July, August, and September. Any of those 4 quarters, and it's still in 2014, it has to be a quarter, and you have up till November the 30th to attest. And I really tell everybody, if you look at the calendar, that's the weekend after Thanksgiving, and a couple of years ago, their system went down after Thanksgiving, so you might want to, my recommendation is you attest way before November the 30th, if you're able to. So, sorry, the payments, this was an interesting fact that they talked about too. You know, the payment adjustments, if you want a payment adjustment, if you want to file hardship for 2016 adjustment year, then you needed to get it in, or you need to get it in by the timelines that are shown. So for the hospitals, there's a different timeline than for the physicians. So again, if it's always a year behind, so if you're not going to be able to attest in 2015, you need to file a hardship or you'll be penalized for 2016 payment. I've had sites tell me, you know what, our Medicare money, our patient population is 3% Medicare, so we don't care if we're going to get penalized. That's the stand. I've had my physician actually said, you know what, I only have 5% Medicare. I'm not going to do meaningful use. It's not worth it to me. So some providers are saying they're just going to take the penalty. So this is the deadlines, no later than April the 1st for hospitals. So again, if you want to file hardship for 2016, it has to be in by April the 1st of 2015. So I mentioned that it does not allow for the objectives and measures to be mixed or matched. They said that at least 4 different times, so just keep that in mind. And again, you'll have to do the CQM year that matches the rules that you attest to. So these are just some great, useful tips. We're going to send you some of these with a follow-up from this webcast. I also wanted to bring in Gyro. If you've ever heard me talk, I talk about Gyro a lot. It's where you can sign up and follow questions about the CQMs. It's a really great website, so I wanted to throw that slide in as well. So this is some other things CMS has said that weren't in their slides, but I wanted to talk about. They said they will be ready in October, could be mid-October. Again, I'll put any information I find out on our Meaningful Use Forum. When we attest, how do we notify CMS that we're going to take advantage of the rule? There were some sites that were hearing, oh, you have to fill out an application. You have to do this or that. What CMS said is when you go to a test, they're going to have their system set that you will swear to a statement that you match everything to be able to take advantage of the flexibility rule. So that's where you'll do it on the attestation. What they said about documenting is you better document it. Very good. Why you were not able to do the stage that you were supposed to in the year that you were supposed to. If you have trouble creating this document, you might bring in outside help. You need to be able to make sure that that document will pass the scrutiny of an auditor. I just had 2 of my customers that just got their approval last night. They were audited in the last few months, so they are still heavily auditing. And they said they are going to be training the auditors. And in fact, I wrote down her exact words. CMS states that the auditors are getting training on what to look for to meet the flexibility ruling. So they are training those auditors on what to look at. That documentation is going to be very important. They didn't say if you fail, what's going to happen. They didn't make that comment, so I have no idea. You just need to make sure that all your documentation, and this is a good time to talk about any documentation. Documentation is so important. Make sure you have everything saved if you're audited. You've got the letters from your vendors saying what version you're using, all of your proof of numerator denominator. They audited the yes-nos for all the menu items for stage 1. We don't know what they're going to audit for stage 2, but I've been telling my customers, like on your portal, you have to have view, download, and transmit for 6.1 and 6.2. If you don't, then your portal's not a viable portal. You need to prove, and I would suggest showing screenshots of where you have view, download, and transmit. So just keep in mind, everything that you attest to, make sure you have the proof to back it up. So effective October the 1st, this is what is supposed to happen. You're supposed to have a full 365 days reporting. So just around the corner, October the 1st starts full 365 days. So if you were going to be in stage 2, year 1 in 2014, and you take advantage of the rule, guess what? You're going to be stage 2, year 2 in 2015. They stated that several times to remember that you're just doing this flexibility year to replace what you normally would have done. Payments are the same, but you will be stage 2, year 2 in 2015, which starts in October. Today, and I'll actually send this as a follow-up, there were 12 major stakeholders that wrote a letter to CMS, Chimes, HIMSS, AHA, AMA, stating that they are still not happy with the 365 days. They say you need to give us the quarter or the 90 days. So I don't know if this letter is going to do any good. They've sent a letter to CMS before about this, and CMS didn't listen to them. So I'll attach that information to our follow-up for this for you to read what was said and who said it. But they're still lobbying very heavily for a 365-day reporting period to be changed to a 90-day. So the other thing that changed, and you may not have been aware of this, CMS came out with or ONC came out saying, you know what, we want vendors to go and get recertified every single year. Not mandatory, but because we have so many changes, we found so many errors in the criteria, we're going to update those on a yearly basis. And they've already updated the criteria that they say were in error. I don't know if they really use the word error, but they said they have new criteria And they were, again, it wasn't going to be mandatory for vendors. Now, vendors have to go through a long process to test. It's very expensive. So I couldn't understand why they were not making it mandatory, but they've backed down on that altogether. So you hear 2014 edition release 2, that's what they're talking about. They wanted to go away from the complete EHR to modular EHR for every vendor, which means going to the chapel is going to be very fun when you have to put 12 or 13 different individual modular certifications in to get your number. But there's a fact sheet you can look at. I'm going to go ahead and let a couple of our customers talk about why they made the decision. Mickey, I'm going to let you start. Mickey's the IT director at Conway Medical Center in South Carolina. So, Mickey, I appreciate you doing this and sharing with people on the line why you made this decision. But also, again, if you have questions for Mickey or our second speaker, put them in the chat window with their name. Okay, Mickey, I'll let you talk.
Okay, good afternoon, everybody. Our stage 1, I don't want to say it was easy, but we did plow through, and we did use the ED. We have MedHost for our emergency department. Our physicians, we're on Meditech Magic 5.66, and we've kept all the updates current. We're like now service release 8, but we've had some challenges with just physicians and the adoption. So stage 1, we went through it, we did it. We attested in September of 2012, and we've moved forward. The dilemma that we've got at this hospital, there's a lot of disparity. We have MedHost in the ED. We are not a true blue Meditech hospital. We have the Shams group out of Dallas, Texas for the electronic health record. We're also setting up their patient portal, which deliverables have been slow. Same thing with transition of care. We're looking at their direct messaging to accomplish that goal for stage 2. We did get involved with the state HIA. It's SCIEX, South Carolina Health Information Exchange. We were an early adopter. We charged into that all in good faith. We lit it up. We tested it. Everything's great. And then it's a matter of other stakeholders in the state that you can exchange data with. So we met all our milestones. We actually got refunded for the energy that we put into this, and now I'm back on with what we're doing with our vendor, the Shams group. Due to the physician's dislike of using Meditech Magic for CPOE, we lit up Patient Keeper. So there's 3 phases with that where we're using CPOE for computerized physician order entry, med reconciliation, and then Note Writer. We're doing well with Note Writer. We're getting ready to turn on the transfer function for med reconciliation. So we come to the reality, because of numbers and the lack of, we need to not go for a testing for stage 2. It was just an eye-opener as we got down the road. I'm looking at the dashboard stuff right now. We're meeting the menu sets, the syndromic surveillance, the electronic lab, and the med administrative record. All those things, we're meeting those milestones, as well as pretty much everything on it, with the exception of our numbers are low for CPOE. We need to get the sustainability up for that. We have rolled out more technology to attract physicians, so we're getting a lot of people coming on, but we're just not there yet.
Okay, Mickey, you know, that was another thing it brought up. CMS did say if patient safety is at risk, by all means do the flexibility rule. They did not want to say you had to move forward if patient safety was at risk.
So that has been an issue, and I have had this discussion with other health systems in our region. It's very difficult for a lot of the quality measures to pass this information and the timestamps that are involved through interfaces versus having it on a full integrated system. Like if we had Meditech's data repository and electronic health record. It may be easier, but for us it's been a big challenge.
Okay. Well, thank you, Mickey. And again, if you have any questions for Mickey, put them in the chat window. Our next speaker is Lyndel Mead from Peterson Regional Medical Center in Texas. So, Lyndel, go ahead and share your story with us.
Hi, good afternoon, everybody. Well, we fought the battle pretty hard for stage 2, and ultimately we decided we got a group together to discuss what we should do once the final rule came out. The rule came out so late in the game that we felt like we had already worked so hard and so diligently, and everybody had worked together, that we needed just to continue on and proceed with stage 2. Plus, what helped drive that fact was that in October we have to be stage 2 anyway. So there was no point, we felt, in going backwards, that it would actually be more detrimental to patient care and to the staff for us to go backwards in what we had already attained as far as the stage 2 measurements that we put in place, the training we had implemented with all the staff, and that it would actually just put us backwards. But we are a full Meditech 6X facility. All our departments use Meditech modules. And working toward, we had, not to say we didn't have challenges. We had lots of challenges to meet the measures just like everyone. But after working so hard and diligently to get everything in place, it was a pretty easy decision by all that we just need to continue on where we are, and hopefully, like Kay said, maybe we'll get a 90-day period out of CMS for the first year instead of having to do a full year, just a 90-day. But that was basically our decision. We're already there. Let's just keep going.
And there's another part of the extension rule that has a limited exception for referring providers who may not be able to meet the summary of care measure in 2004. Core 12 has been called all kinds of names. One of the things I think that was wrong with that measure was that you have a lot of your providers that you're transferring patients to that are not under meaningful use. They have no incentive to purchase a direct mailbox. But what they said is if your transition of care referrals, they will grant you an exception if the referring providers are limited and they don't have their upgrade to 2014 certification. Now, I don't know how many hospitals that would ever be, because you'd have to be pretty limited to who you're sending your transmission of care to. I think it really helps the physicians if it helps anybody.
Yeah.
Anything else, Linda, you want to say before I move on?
No, I can't think of anything. I was just, like I say, for us it was an easy decision, but we felt like we had everything in place already, so forge ahead and be ready for stage 2 full year starting in October.
Okay. Amanda, are there any questions for either of our guest speakers that have come in through chat?
We do have a question here for Lyndel. It says, what patient portal are you using?
We are using Meditech.
We'll share. If anybody's having trouble with their portal, feel free to call me. I can give you some great ideas of what people have done to really help meet their measure that had been struggling. And by the way, I'll throw this in right now. For 2015, CMS did another change. If you're not aware of it, CMS has dropped ED3. So they're going from 29 CQMs to 28 CQMs for 2015. And they just announced that a few weeks ago. So thank you again for letting everybody know it is a very short time. Any other questions?
So far, Kay, we don't have any others for our guest speakers.
Okay. I'm going to go ahead and move forward then. And Cindy Paul. Cindy, I'm going to let you start and do your presentation, please.
Thank you, Kay. So making the decision that's best for your organization. Truly, this is a strategic decision that really requires your meaningful use team coming together and sitting down and figuring out what makes the best sense for your organization. And the first step is to look at your technology that you currently have in place today and identify, is what you have in place today going to meet all of the meaningful use objectives required? Secondly, looking at your workflow and identifying, is the workflow fitting best with the technology that you have, that you're certified for, and are you in fact going to be able to meet all of these requirements easily? So if you decide to take the flexibility rule, it truly is very multifaceted. There are several layers to making that decision and just evaluating and coming up what the best decision is that suits your facility. And like Mickey said, it's not just your meaningful use measures, but also looking at your quality measures and your quality improvement, and then most importantly, how does this affect your patient safety? So CMS made a point that they really wanted to emphasize that this flexibility rule is implemented for hospitals that are out there struggling with their objectives, especially with Core 6 and Core 12, with the patient portal and transitions of care. And they want to emphasize that they're doing this flexibility rule so that you are able to use your certified technology that you have in place today to meet these meaningful use measures. We encourage you guys, everyone on the call, to use the resources and the CMS websites that we've provided on this webcast, and also just to know that you don't have to go at it alone. Professional services with Iatric Systems, on the next slide, Kay, we can look at how professional services can help with making that decision. We have consulting services that are available to come and work with your team to really help identify and make that best strategic decision for your facility. The process for this would be looking at all of the different decision-making factors that are important, looking at the technology that you have in place today and the functionality of that technology. Just because you have Meditech's portal or another vendor's portal that's certified, that doesn't mean that that full functionality is there. So Iatric Professional Services will come in and help to identify what your workflow is and how that functionality of what you have in place is working. We'll also help to collaborate with your staff and your meaningful use team. And really the most important part of this flexibility rule, as Kay emphasized, is documentation. So our consultants will help with that documentation and make sure that explaining all of the different layers of and reasons of how you came to the decision to take the flexibility rule, that all of that is very well documented, so that in the future of not if, but when you are audited in the future, because that rate of audits is increasing every year, we want to make sure that all that documentation is there, easy for you, and our consultants are experienced and really want to be able to offer assistance for the greatest success. I guess with that, I'll turn it back over to you, Amanda. We thank you for joining our webcast and really encourage you to use these resources and the information that we've provided. And please don't hesitate to reach out to professional services and allow us to help you with some of this guidance.
Thank you, Cindy. Okay, Amanda, any questions in the chat window for us?
Yes, we do have some. The first question is, do you know if we do qualify for the flexibility rule and we need to do stage 1 again, is it for an entire year or just for 3 months?
That's a great, yeah, that's, I'm sorry, go ahead, finish.
I'm sorry. It just says this would be our 4th year of stage 1.
Right. For 2014 only, and even with the flexibility rule, CMS has said you only have to attest to a single quarter. So they did say in that presentation, if you decide you're going to go back and do Stage 1 2014 rules and you want to do January, February, March, go back and attest to January, February, March. You've got 4 quarters to choose from. You do not have to do a full year. In fact, when it first came out back in May, that was the first question I asked Elizabeth Myers that very first day. What does this mean? And she, way back then, said, no, it's still going to be the rules for 2014 for the reporting period. Okay, the next one, please.
Okay, the next one is, in regards to the 10% transfer of care using direct messaging, if the providers we may refer to do not have direct messaging, or just recently got it, and we are unable to meet that measure, can we use the flexibility rule?
Yes, and that's what I just read, and in fact, when I send out the information, and I'll read it again, the rule does provide a limited exception for referring providers who may not be able to meet the summary of care measure in 2014, which requires the transmission of an electronic summary of care document for more than 10% of transitions or referrals. CMS granted referring providers a limited exception if the referring partners have not upgraded to 2014 certified software. So the way I read that is if your partners that you're sending it to don't have 2014 edition software, you would qualify. If it's just that they, don't have a direct mailbox or some other issues, that may be something you need to really take a look at. But we will have this part of the rule for the transition of care outlined. Every time I talk to Elizabeth or anyone at CMS, I kept telling her, guys, you did not think this one through. There is, like I said, I talked to one hospital, 60% of their patients go to a nursing home. Nursing homes don't, that particular nursing home doesn't even have an electronic system. They're handicapped by the fact that the majority of their discharge dispositions that they're going to track have no direct mailbox because they're not under meaningful use.
Okay, the next question is there a reference for the ED3 removal for 2015? Where did you get that information?
Yeah, I'm going to send that with the follow-up after this. It came out with CMS, and like I said, CMS does a really good job, I guess I would say a really good job, of educating the vendors. They have a call with us every single month. And then they had another presentation, and they kind of glossed over it. But I will send you what the slides that they provided stating that, and then some other changes for 2015 on the CQMs. We will add that as well.
Okay, the next question is, any recommendations on the patient portal access measure?
Well, this has probably been one of the hardest ones. In fact, CMS gave us 3 different rulings that contradicted each other just in a single year. If you read the specification sheet, and CMS has acknowledged that many of their specification sheets for Stage 2 are wrong or have errors, you would read the 6.1 as you had to have your data available for your patients in their portal at 36 hours. That was not their intent of 6.1. The intent of 6.1, and I can send this to you as well, is that you've provided the patient access to the portal, everything they need to create their account. The 36 hours is just an incidental. They want the data there within 36 hours, but for 6.1, they want you to prove that you've provided access to that patient for their portal. The thing that we've seen a lot is some portals, and we've worked with 12 different portals with our different customers, some portals require an email address before you can create the code to even provide them access. A lot of patients are very hesitant to give email addresses. I was caught up in that 4.5 million people that were for that big breach not recently. And my doctor says now more and more patients don't want to give email addresses. They're afraid of what's going to happen. So you just need to know that it's based on access provided to the patient, and we'll send that as well. What I've seen a lot of sites do is actually, at registration, they're giving information. If the patient's too sick or that's not the time they want to do it, they're even going to the floor with iPads or CALs and showing the patients right then in the floor, hey, let me sign you up for the portal and show you all the benefits of having it. CMS has come out and said if that patient accesses the portal while they're in the hospital, that does count. I think the biggest thing to keep remembering about 6.1 and 6.2 And this is another way thing that CMS first said, oh, you don't have to have transmit, and then they came back and said, yes, you do. You have to have view, download, and transmit all available for 6.1 and 6.2. So we'll send you that documentation as well. And if that didn't answer your question, feel free to email me or call me.
Okay, the next question is, on transitions of care, can we use the PCP to meet that measure?
Yes, and actually, there's a recent FAQ on that as well. I'll send that, probably send y'all a lot of stuff. But one of the things that it said was that, and it steps you through 12.1, 12.2, and 12.3. That especially if you're sending a patient home, that PCP is the provider that they want you to update. Remember, it's only one CCD that has to be sent per patient, and you might send out 5, but we're only going to count the 1, or your vendor's only going to count the 1. So I will send that FAQ too. It walks you through. I've had more questions about the 12.3, the yes/no one, than probably anything. And if you've done 12.2, you can turn your yes on 12.3 on, or they have a randomizer that you can actually run through your CCD and check with CMS. So we'll send you those FAQs as well.
Okay, the next question is, what happens if you don't meet a measure?
If you don't meet a measure and you're unable to attest, you are going to have a penalty unless you filed for a hardship.
Okay. These are great questions, and I do want to thank everybody. Please keep them coming in. Okay, at this time, we don't have any. We'll give them a chance to type some more.
Okay. Well, we'll be sending out the slides. I've got several other things I'm going to send out. I'll send out the PowerPoint where it shows that ED3 has been dropped. I'll send the FAQs on the portal, and what we receive from CMS is what they wanted to do. And the other thing about Core 12 and Core 6 on Stage 2, they left out that the method applies to both of those measures. So just another mistake that they made, but we verified that the method applies. Observation is all of your observation patients in place of service 22 and 23 and all of your inpatients. ED patients are all your ED patients and all your inpatients. So that does apply to your portal, and it does apply to Core 12. Keep in mind that newborns are excluded. I had one site that was signing up all their newborns for their portal, and they don't count because newborns are excluded from meaningful use regulation. And then we'll send you the FAQs for Core 12 as well.
Okay, we have another question here. Can you expand on the penalty and how the sequestration that is affected?
Okay, I can send you a lot of good information on the penalty. What it is, it's a percentage. I can't tell you what it is for your facility, but it's a percentage that would apply to all of your payments for a full year. So if you were unable to attest in 2014, say you couldn't do the flex rule, you couldn't do what you were supposed to do, you just couldn't attest for 2014, and you hadn't filed for a hardship, then your 2015 payments would be, there'd be a percent that would be deducted because you did not attest. It's a year thing, so if you attest the next year, it's not going to apply to the next payment year. So it's just a single year for any year you do not attest. So I'll send more of that information of where you can calculate your penalty as well.
Okay. We still don't have any more.
Okay. Well, Cindy, is there anything you wanted to say, or Mickey and Linda, before we hang up?
We appreciate this call. It's been very informative, and we just shot you an email, okay? We're interested in some assistance.
Okay, great.
For the flexibility option.
Thank you, Mickey.
I have nothing else. I appreciate the opportunity.
Okay, thank you both I just thought it'd be good to let you hear. I can talk all the time, but if you hear from two sites that made that decision on what they were going to do, that would give you some guidance or give you some information on what other providers are doing. So, Amanda, if there's no more questions, I'll go ahead to the next slide.
Okay, thank you, Kay. I would like to thank everyone for attending our webinar today. Again, you will have the opportunity to fill out a short survey to tell us how we did. The survey will appear when you close your Internet browser. For your time, your name will be entered into a drawing to win a $100 Amazon.com gift card, and all of our drawings are held at the end of the month. Be sure to follow us on LinkedIn, Twitter, Facebook, and Google+ for up-to-date product information and announcements. If you would like more information, please contact your Iatric Systems account executive, or you can send an email to info@iatric.com. I'd like to thank our presenters and also thank everyone once again for taking the time to join us today. I hope you have a great day, and this concludes our webcast.